and women's reproductive freedom. And then they're punishing women who simply are trying to access health care they need. They're punishing them as criminals and doctors as criminals. And they're letting women die by restricting necessary care. Less freedom in your life, more government interference in your personal decisions. That's the MAGA way. Democrats are going to fight these extremist efforts on every front. Thank you, Patty.
Thank you, Senator Schumer. And again, thank you to all of our witnesses who are here to help us understand what is happening across the country. Your testimony is absolutely critical for people to understand what's going on. So again, welcome to all of you. We're now here from our 5 witnesses, and we're going to begin with Samantha Casiano. She is a patient advocate from East Texas. Samantha, go ahead with your testimony.
Thank you, Senator Murray, for allowing me the opportunity to testify and speak on behalf of HALO and my family. My name is Samantha Casiano. I'm a mother of 5, a taxpayer, and the first in my family to graduate high school and attend college. I work hard every day to make sure the bills are paid, mouths are fed, and my family stays healthy. I did everything I was taught to do. I never thought a law would touch my family the way that it did, but it did. In December of 2022, I was 20 weeks pregnant with our 5th child, a girl, exactly what we had hoped for. At my 20-week scan, I received the devastating news of my life that our daughter had anencephaly. And anencephaly means that her brain and her skull would never fully develop, and she was 100% incompatible with life. She was going to die. The only question was when and whether she was going to die inside of my body. Before I knew it, putting my own risk at life, I thought for sure I would be granted an exception. I thought my doctors could show HALO and I compassion. I was wrong. When I asked what my options were, I was told that I live in the state of Texas where there's an abortion ban and that I must go on with this pregnancy. The one person I trusted with my life, my doctor, my healthcare provider, had her hands tied by the state. Helping me could have sent her to jail. For 20 weeks to 32 weeks, I woke up every morning pregnant, feeling HALO move, knowing at any moment she was going to die. I planned her funeral while still attending my children's school events. I set up crowdfunding pages to cover her burial while going to work every day. I smiled and made small talk while people asked to rub my belly. I held myself together for my other children because that's what Texas law forced me to do. I had no rights to my own body. I was a vessel to the state. Even though I did not get an abortion here or out of state, my family and I lived in fear. We were afraid to say the wrong thing, afraid to ask too many questions. We were worried that even searching for information about options outside of Texas could somehow get us in trouble. We couldn't risk it. My family, my children needed me. My husband needed his wife. When I went into the hospital in labor, I sat in the lobby getting my vitals. I told them my daughter's diagnosis. They told me to sit back in the lobby in the waiting room. I sat there with my hands between my legs until I showed them that I was bleeding. Only then I was taken upstairs. When I went upstairs, I was told I was already 7 centimeters dilated. HALO was breached. I was given Pitocin and told to push. My daughter HALO lived a few agonizing hours before she passed away. While she was here, her eyes started to bleed. She was like a fish think of a fish, and you pull it out of the water, and this fish is grasping for air. That was HALO. She changed colors right in front of us. Pink, red, blue to purple. Warm to cold. She was in her father's arms until she was gone. That trauma is permanently imprinted in my memory because under Texas' cruel abortion ban, I was forced to give birth to a baby every doctor knew would not survive, and then walk out of the hospital as if nothing happened, like she was never here. It was like sending my child into a war that I knew she was going to lose. It was cruel and it was inhumane. Let me offer a different perspective. If your child were in a car accident and was missing part of her skull and brain, would you be at peace with the doctor telling you to simply watch them change colors while they suffocated to death, rather than allowing you to take them off of life support? My womb was Halo's life support. I was not allowed to make that decision. The state made it for me. Exceptions do not work. When people need access to care, there is no exceptions. Preventing doctors from doing their job is dangerous. I know firsthand because I lived it. I did not plan on having a story to share today. I never imagined I would be here speaking before you. But what happened to me in Halo will keep happening to other mothers and families until we make a change. So here I am today. Many women do not know what's happening to them. Many women do not know this is happening to them until it happens. Right now, as we sit here, there's a woman out there reliving my nightmare. I want her to know that she is not alone. I see you, I hear you, and I stand with you. Mental health is life of the mother. I will give my last breath, as Halo did, to make sure that that happens. Thank you for hearing me today.
Samantha, thank you. Thank you. And I know that was really hard for you to share that story, but it's so important for everyone to understand, and my heart goes out to you and your family. Thank you for being here today. Next, we have Kaitlyn Kash. Kaitlyn is a patient from Austin, Texas. She's here as well to share her personal story. Kaitlyn, go ahead.
Thank you, Senators, for having me here to speak today. I noticed that my Texas Senators are not present, so thank you for listening to me. My reproductive journey has been turbulent, to say the least. My first pregnancy was fairly textbook, so when I started trying again for a second baby, never in my wildest dreams did I think it would bring me here. I found out I was pregnant with my second pregnancy in July of 2021. All of my prenatal appointments had been fine. I went in to my end of first trimester scan with no concerns, and I left with a referral to a specialist. At that appointment, we found out that our baby had a lethal genetic diagnosis affecting bone development. Soon, my baby's bones would begin to break in utero, even at the slightest movement, like bending down to pick up my then 3-year-old son. At birth, his rib cage would be too small to support lung function, and we were told that he would suffocate at his first breath without extreme medical intervention. That diagnosis came 25 days after Texas's SB 8 went into effect. Because of that timing, my doctor was silenced. SB 8 turned every Texan into a potential bounty hunter. Any private citizen could sue anyone who aided and abetted an abortion. That resulted in an appointment where I was told that my baby was going to die, and my doctor could not give me the dignity of explaining all of my options. We could talk about my right as a mother to not put my baby on life support after birth, but we couldn't talk about removing the only life support my baby had ever known, my body. At the end of the appointment, I was handed a printout of my medical records, and I was advised to seek a second opinion, but outside of Texas. As a grieving mother, instead of being able to focus on processing the loss of the future that I had been dreaming of from the minute the test turned positive, I was on my bathroom floor, catching my breath between crying and throwing up, Googling clinics. My husband went to buy a printer so we could print and scan waiting period consent forms from home because we were too afraid to use a public printer. 10 days later, I had the privilege to board a plane. I walked past protesters at the clinic who called me a murderer, and I said goodbye to my baby in a room alone with a nurse and a doctor that I'd just met that morning. A few days later, I flew home, making sure to get up frequently enough to avoid blood clots and hoping a super maxi pad would be enough to prevent me from bleeding on the seat. My husband and I were grieving, but we desperately wanted to grow our family. A few months later, I was pregnant again, but my third and fourth pregnancies ended in miscarriage. 9 weeks into my third pregnancy, after clinging to the denial and bleeding at home for 5 days, I finally went to the OB to confirm that I was losing this baby too. After finding no heartbeat, my doctor confirmed that I needed medication, the same medication that is used in medical abortions. My prescription was challenged, and I was treated like an addict looking for drugs instead of a mother losing her child. I was finally able to obtain the medication I needed through an online pharmacy and took it a few days later. My husband and I then chose IVF. We started injections the September after Dobbs was decided. And in case IVF wasn't stressful enough, every appointment ended with my doctor and I deciding if she felt comfortable proceeding, as she navigated the growing uncertainty around how IVF intersects with abortion restrictions. 11 months later, we finally welcomed our second child, the result of my fourth pregnancy in less than 2 years. As I lay there holding my baby on my chest, my doctor informed me that my placenta was not delivering. I needed a D&C, a procedure used to clear tissue from the uterus. And yes, it is also used in abortions. And I needed it quickly. 50 minutes after my daughter's birth, I started violently throwing up and shaking, still in the delivery room, waiting to go to the OR. When they finally took me back, I remember rushing and shouting. I lost consciousness as I went into hemorrhagic shock. My records indicate that we were finally able to start my procedure 1 hour and 59 minutes after my daughter's birth. When I woke up, I had lost half of my blood, and I was told that I'm lucky I still had my uterus. Instead of spending my daughter's first night in the world with her, I was in an ICU bed while a nurse cared for my baby 3 floors away. After attempting to get answers on what had gone wrong, a hospital social worker listened to my account. When I got to the part about the D&C, she interrupted and plainly stated, "Well, we don't do those procedures anymore." That one sentence said everything. This delay wasn't chaos, it was policy. You do not know the healthcare you need until you need it. You can be against abortion for yourself. You can never choose it. But you cannot restrict access to a category of medical care without consequences that reach every pregnant person in this country. Restricting healthcare often means that the medication and equipment isn't readily available or needs administrative approval, delaying care with deadly or life-altering impacts. Reproductive healthcare is a continuum, and the government should not be able to decide what parts of that care you can access. When politicians get to decide what healthcare is moral and immoral, every woman you have ever loved is put at risk. These states' bans are forcing unimaginable pain and pushing hundreds of thousands of women into impossible situations they never saw coming. Trust me, I never saw it either.
Kaitlyn, thank you so much for sharing that. I can't imagine all that you've gone through, and our hearts go out to you as well. Thank you for having the courage to share your story so people know what the consequences of this is. Thank you. With that, we will turn to Megan Jaifo. She is the Executive Director of the Chicago Abortion Fund. Megan, thank you for being here.
Thank you, and thank you, Samantha and Kaitlyn, for really bravely sharing your stories. Good afternoon, and thank you, senators and members of the Senate Democratic Caucus, for convening this conversation today and for your continued leadership on reproductive freedom. My name is Megan. I use she, her pronouns, and I'm the Executive Director of the Chicago Abortion Fund. We are Illinois' statewide abortion fund, a member of the National Network of Abortion Funds, and the largest independent abortion fund in the country. And although I am now CAF's executive director, I began my work with the fund as a volunteer case manager. And I'd like to share the story of a call I took not too long ago that captures the reality of so many of the people we support are facing. The caller was a woman from Kentucky, where abortion is banned. She called CAF from outside of her car, outside of a pregnancy center in Indiana, also under a total ban. The center had led her to believe they could provide abortion care, so she had driven there alone, hoping to get help. Instead, she found herself miles from the care she needed. She had already taken time off of work, spent money on gas, and arranged childcare. Now she was learning that the appointment she thought would provide care had really never been care at all, but a dangerous diversion. Within minutes on the phone, we had a plan. We helped her get home, covered childcare, secured an appointment at a legitimate clinic, and booked a flight to Chicago, where she received the care she wanted with dignity and compassion. Unfortunately, her story is not unusual. Every month, we hear from hundreds of people facing barriers created by abortion bans, financial hardship, and a healthcare system that is increasingly difficult to navigate. About 75% of our callers are already parenting, and 80% live in states with abortion bans or severe restrictions, and all face obstacles to obtaining care. And that's where we step in. Every day, our incredible team helps people overcome barriers that no one should have to navigate alone. We have built a model for abortion access in the post-Dobbs era and support abortion seekers at every stage on their path to get an abortion by paying for appointments at independent clinics, Planned Parenthoods, telehealth providers, and hospitals, and by providing complete wraparound support for their needs. In the first 3 months of 2026, we did that for nearly 5,000 people. Since June 2022, we've helped more than 60,000 people access abortion care and provided over $25 million in direct support. We have spent countless hours on the phone with callers from more than 40 states, helping them piece together a path to their abortions when politicians interfered with their decision-making. Data released this month by the We Count study confirms what we already know. Abortions have not declined since Dobbs. They've actually increased. And in part, that's because people who can no longer get an abortion in their home state are coming to Illinois. In 2025, 142,000 people crossed state lines to get an abortion. 142,000 people had to leave their home state to get a common, essential, life-affirming, and often life-saving medical procedure. 1 in 4 of those travelers came to Illinois, making us by far the highest receiving state in the nation, and nearly half of those traveling to Illinois for their abortion received support from CAF. What we're seeing is reflected in the most recent national funding data from the National Network of Abortion Funds. Costs continue to surge. The total spent on abortion funding has tripled since Dobbs, from just over $16 million to more than $48 million. Every day, we hear from people trying to make thoughtful decisions about whether to start or grow their families while navigating rising costs, unstable housing, very inadequate childcare, and ever-shrinking social safety nets. Recent federal and state policy decisions shape those realities. For many of the people we serve, the decision to have an abortion is inseparable from the economic conditions in which they are raising children and planning their futures. This fight, however, is not new, and we know what this moment requires of us. The Chicago Abortion Fund was founded more than 40 years ago. Many of the women who built this movement have told us they never imagined their children and grandchildren would come of age with fewer abortion rights than they had themselves. We do draw strength from the history of this movement. Chicago is home to the Jane Collective, the underground network that helped thousands of people access abortions before Roe. It is also the birthplace of the reproductive justice movement, created by 12 Black women in 1994 who challenged us to imagine something bigger than legality alone, a world where every person has the power, resources, and support to make decisions about their bodies, their families, and their futures. These legacies remind us every day that we come from a long line of people who have never confused legality with justice and who have never stopped showing up for one another when the stakes are high. That is what abortion funds get the privilege to do every day. Because of this work, I've had the privilege of speaking with and learning from thousands of people seeking abortion care. Over and over, I hear the same thing from callers. Because they were able to access abortion care, they could focus on the child they were already raising. They could finish school, keep a roof over their heads, or simply move forward with their lives on their own terms. They tell me, "You changed the course of my life." And I understand exactly what they mean because I had an abortion when I was 16. If I had not been able to access that care, I would not be the mother of amazing twin preteens. I would not be sitting before you all discussing my life's work. That abortion changed the course of my life, and 4 years after Dobbs, I know it continues to change the course of countless lives every single day. We have an incredible support system in Illinois, and we're so grateful, but we still need funding and support to continue doing this work. That's why we need bills like the Reproductive Health Travel Fund Act and the Freedom to Travel for Healthcare Act. Together, these bills would support the critical work of abortion funds and ensure no one is criminalized for obtaining or helping someone get their abortion. Even when abortion access fades from the headlines, abortion funds and providers will still be here doing the work day after day. We will still be answering the phone. We will still be booking the flights. We will still be finding a way. 4 years after Dobbs, we are still here, and we are not going anywhere. Thank you.
Megan, thank you so much for the incredible work that you and your organization are doing. Thank you. Next is Evelyn Keltica. Evelyn serves as the Senior Vice President of Program Services at Maine Family Planning. Thank you for being here. Go ahead with your testimony.
Thank you. Good afternoon, Senators, and thank you for inviting me today to discuss the devastating attacks on reproductive rights in women's health care. As I said, my name is Evelyn Keltica. I'm a board-certified family nurse practitioner and Senior Vice President of Program Services at Maine Family Planning, where I've worked for nearly 32 years. I oversee MFP's programming, including clinical care at sites throughout the state, as well as educational, health, and social service programs. Maine is one of the most rural states in the nation. 40% of its population lives in rural communities where access to health care can be difficult and in some cases out of reach. Shortages of family planning and reproductive providers, along with the closure of hospital labor and delivery units, have left many patients with few to sometimes no local options of care. Many of Maine Family Planning's programs are located in federally designated medically underserved areas. This means our clinics are the critical source of care for patients who may have nowhere else to turn. Throughout our 18 clinics and a mobile medical unit, Maine Family Planning provides essential services including annual gynecological exams, cancer screenings, contraception and family planning services, STD testing and treatment, hormonal therapy, miscarriage, and abortion care. Each year, our clinics serve over 8,000 patients. In 2025 alone, family planning patients made more than 11,000 visits for preventative and reproductive health care services. Once more, Maine Family Planning partners with an additional 44 clinics across the state. This network provides access to sexual and reproductive health service in 15 of Maine's 16 counties and serves approximately 30,000 patients annually. At Maine Family Planning, we are more than a provider of health care services. We build trusted relationships with patients, often over the course of many years. Patients turn to MFP because they know they will receive expert, compassionate, and confidential care. I just need to take a moment, as a provider for many years in our clinics, there's a moment when I'm ready to walk out of the exam room and the patient says, wait, there's something I want to tell you. And that's the moment of truth. That's the moment that I've created an environment that a patient is willing to feel vulnerable and safe and trust me to disclose her most intimate things that she's worried about and concerned about, and giving me the privilege of helping her navigate life-changing events. So I just wanted to share that as something that's really personal to me and why I've been in this business for almost 40 years. Unfortunately, the loss of Medicaid funding as a result of the 2025 reconciliation bill has brought immediate and far-ranging consequences. A number of years ago, Maine Family Planning tried to meet the state's healthcare crisis head-on by expanding into primary care. However, because this model was designed to serve Medicaid patients, we were forced to end primary care services after losing our Medicaid funding. This impacted 3 of our rural clinics in October 2025, disrupting care for nearly 1,000 patients. Discharging and redirecting these vulnerable patients cuts directly against Maine Family Planning's role as a trusted community provider. Our clinical staff worked extensively to identify alternative primary care providers across 3 rural regions, confirm the practices were accepting new patients, and coordinate patients' referrals. Even with these efforts, many of our patients faced unavoidable delays of 3 to 6 months to establish care with a new provider. Others experienced longer travel distances, increased wait times, and higher costs with an already strained healthcare system. The uncertainty around Medicaid reimbursement has also had significant operational impact. When we had to stop offering primary care services, we lost 4 positions, including 2 medical providers. Nevertheless, today, Maine Family Planning continues to serve Medicaid patients, relying on restored Title X funds and our limited reserves. Our exclusion from Maine Care for Medicaid reimbursement has created additional costs and administrative burdens, which also require us to expand our outreach efforts to let patients know they still have access to care. Congress has the power to restore the Medicaid funding to family planning providers who also offer abortion care. I'm asking you to do everything in your power to do so. Healthcare and well-being of Mainers and their families, as well as patients across the country, depend on it. Thank you.
Thank you very much, Evelyn. Thank you for being here today and for sharing what's happening in your state and really in the country. Really appreciate all you do. Finally, we will turn to Alexis McGill Johnson. She serves as the president and CEO of Planned Parenthood Federation of America and Planned Parenthood Action Fund. Thank you for being here today.
Thank you so much to my fellow panelists for their incredible advocacy and sharing of your personal stories. Thank you also to Senators Murray, Baldwin, Smith, and Warren for hosting this hearing and keeping reproductive freedom at the top of the agenda, and all of the senators who are here fighting for reproductive freedom. Planned Parenthood is the nation's leading provider of sexual and reproductive health care. Every year, over 2 million patients rely on around 550 Planned Parenthood health centers for affordable birth control, cancer screenings, wellness exams, STI testing and treatment, and abortion, which we proudly serve where legal. Planned Parenthood health centers welcome everyone. In many communities, they are the only providers of reproductive health care. They disproportionately serve rural areas and places with shortages of health professionals. In short, Planned Parenthood plays a critical role in the healthcare safety net that no other provider can fill. But none of that matters to opponents of reproductive health care. This week marks 4 years since the Dobbs decision. It also marks nearly 1 year since President Trump and Republicans in Congress defunded Planned Parenthood by aiming to block Medicaid patients from using their insurance at Planned Parenthood health centers. These things did not happen by accident. They are a part of the anti-abortion movement's coordinated, decades-long plan to make it harder for everyone, everywhere, to get an abortion, and the consequences have been devastating. Since the Dobbs decision, more than 100 Planned Parenthood health centers have closed across 18 states. More than 20 of those health centers have closed since defund. A report led by Leader Schumer and Senators Warren and Wyden found that over the past year, cutting off Medicaid has cut people off from time-sensitive, life-saving care. Last November, visits for birth control pills were down by 20% compared to the same period the previous year. STI testing has declined by 11%, and in December, breast exam visits declined by 25%. That means cancers are going undetected and STIs going untreated. It means patients are unable to plan for their families and their futures. Now, this crisis is happening on top of the crisis caused by the Dobbs decision. 20 states now ban abortion, and we know that bans do not stop abortion. They only add burdens to those seeking them and to those providing them. Look at a state like Georgia, which has a 6-week abortion ban. Rather than face the prospect of criminal charges for providing basic health care, providers are simply leaving. Around half of Georgia counties have no OBGYN, and the state's maternal mortality rate is among the worst in the nation. Because of abortion bans, women in Georgia and across the country are losing their lives. 28-year-old Amber Thurman in Georgia went into sepsis while doctors refused to intervene. 37-year-old Tierra Walker in Texas died of preeclampsia after hospitals turned her away. And 34-year-old C.G. Graham in North Carolina died of a heart condition while she waited for an abortion that could have saved her life. I say their names not as statistics, but as indictments of a system built by cowards. Cowards who look at women in pain, women in danger, women begging for help, and saying, no, just wait. Wait until you're sicker. Wait until you are closer to death. Wait until we decide your treatment. These cowards continue to push their agenda regardless of the human cost. The law defunding Planned Parenthood ends on July 3rd, but congressional Republicans want to make it permanent. They have assured anti-abortion groups that they will continue to attempt to use the reconciliation process to advance this goal. We also know multiple legal challenges to mifepristone. The Supreme Court ruling in May allowed patients to continue receiving it by mail for now. But we know as the case moves through the lower courts, the U.S. Food and Drug Administration announced a sham review into mifepristone, suggesting the agency will keep trying to ban it or restrict it. And we are also bracing for new threats to the Title X program, the nation's only federal program dedicated to affordable family planning. The Trump administration appears ready to cut Planned Parenthood affiliates out of the program, which would strip birth control and other essential care from millions of people. Now look, your constituents deserve better than this cruel agenda, which they oppose in overwhelming numbers. 72% support access to medication abortion like mifepristone. 80% of Americans do not want the government involved in abortion, and 69% oppose Congress extending their defund of Planned Parenthood. But no matter what happens, we will all be here fighting. We know we can't do it alone, so please use every lever you have to defeat these policies, oppose any attempt to continue defunds, stand up for your constituents and tell their stories. Keep pushing for a better future where everyone can access reproductive freedom. We're so appreciative of your leadership and support. Thank you.
Thank you so much, Alexis, and thank you again to all of you. Look, we're here because Republicans chose to empower anti-abortion extremists, and we are not going to let them ignore the reality of the damage they've done. All of your testimony is absolutely critical so people know what is going on. You know, let's be clear, when Republicans voted to defund Planned Parenthood, they knew they were voting to shut down clinics and rip away health care. When they voted to confirm Justice Kavanaugh, they knew they were voting to overturn Roe v. Wade. Our votes here have real power, and all of us have to live up to that. So we are grateful to all of you for being here today, and I will begin some questioning and then turn it over to my colleagues. And Samantha and Kaitlyn, thank you for telling your very personal stories. I know neither one of you thought you would ever be here today sharing a story like you just did. Thank you for doing that for so many women. I want to ask you each, do you think any woman in this country can say the overturning of Roe v. Wade hasn't had an impact on them? Samantha?
I think that it's had an impact, if not on them, then people that they love, whether it's their nieces, their siblings, our generation is going to grow. So as we grow, someone is going to get hurt. And that's just a fact. There's no way around it.
Kaitlyn?
I mean, I don't believe that you can just limit the impact to women. I would say that every American has been impacted by these laws, whether they realize it or not. I mean, my husband was impacted. He sat alone in a delivery room holding our newborn daughter, a baby that we hadn't even got to name yet, while they wheeled me off for an emergency procedure that they said would take 30 minutes, and they didn't update him on how I was for 2.5 hours.
So everyone has been
yes.
impacted. Evelyn, let me ask you a similar question. Do you think women in Maine can say the overturning of Roe v. Wade has not had an impact on them?
It's definitely had an impact on them and their families, to Kaitlyn's point. It's created confusion and disruption in whether or not they can get any reproductive health care. Our phones rang off the hook when Dobbs' decision happened because people heard we can't get care, and they worried they couldn't get family planning care and essential reproductive health care services. And we had to make extensive communications to ensure people they still had access to those services, including abortion care in Maine.
Right. I mean, I hear too many people going, this won't impact me. But this impacts absolutely everybody. So that's, again, why it's so important for all of you to share your stories, and we all really appreciate it. Alexis, let me return to you. Thank you for everything Planned Parenthood does to support reproductive health care access. I think every one of us knows how important that is to people around us. We've heard their stories. We know. I just want to ask you this. Republicans argue that they sent abortion back to the states. I hear that all the time. But here we see them pushing for national policies. I don't think abortion decisions belong with states or with the federal government. I believe it belongs with women and their doctors. But I wanted to drill down on this question about bans affecting states. In states with abortion bans, how have healthcare outcomes and access been affected?
Well, I mean, Absolutely. When the decision was pushed to the states, it essentially means that there are states where people are free to make their own private medical decisions, and states where they are no longer. And that could happen in the case. I started off in New York with my 2 daughters, and they have all a set of rights. And then we go down and visit their cousins in Georgia, and all of a sudden their rights have changed, right? So we're talking about living in a world where just by virtue of where you travel, you no longer have the same level of equality, and that inequality has been codified into these state laws. So when you think about an abortion infrastructure that was already quite fragile prior to the Dobbs decision, and you now have states that are pushing patients from states with bans into states without bans, you are further straining a system, right? As my colleague Evelyn spoke about what's happening in Maine, the rush of patients coming to them. A recent Johns Hopkins study signified that abortion bans are associated with a likely 9% increase in deaths related to a lack of access to abortion care within a year of birth or during pregnancy. So we already know that we're building on top of a world where Black
9% increase in deaths in states where they've banned
yes,
abortion.
correct, yes, likely.
That is
Yes.
stunning.
On top of already what we have seen a maternal mortality crisis, where Black women are 3 to 4 times more likely to face maternal mortality. In states with bans, the Black maternal mortality rate is now 234% higher than white maternal mortality in banned states. So there's no question that the bans are having a tremendous impact, because abortion bans have also made pregnancy more dangerous. When you see doctors who are no longer deciding to practice in states with bans for fear of criminalization, and you see residents who are no longer choosing to go into OBGYN as a field because they fear that they will no longer be able to practice to the limit of their expertise, that becomes a huge challenge for all of us. So the outcomes are not limited just to banned states, it's across the board.
True, and in states like mine where abortion is not banned, obviously, what's the impact in states like that?
You are seeing, obviously, more impact on the ability to get appointments, right? You have people who are coming into states that have access, and it is straining the system, a system that has, again, had already been under strain. That's why the attempt, particularly for Planned Parenthood, the backdoor abortion ban was designed to put further strain on the system, particularly in states that have access.
Absolutely. Well, thank you. And I'm going to turn it over to Senator Smith for her questions. Thank you for being here.
Yeah, thank you so much, Senator Murray, and thanks to everybody on our panel for being here, and also just for your advocacy. Ms. Kash and Ms. Cassiano, I want to ask you this question first. I'm struck by how people like those that represent you in the United States Senate don't really want to hear the stories of women affected by the decisions that they've made, these abortion bans. And in fact, they kind of tend to, I think, either say, kind of turn people into cardboard cutouts of themselves, or they say, this doesn't really happen. And so if they were sitting here today, you said, Ms. Kash, that they're not. If they were sitting here today, what would you want them to hear about how their decisions have affected your lives?
Well, before I answer that really fast, I do want to say that this is my 3rd Dobbs Hill Day. I've traveled up, for 3 years now, and no Texas senator has met with me in those 3 years. They don't want to hear our stories. They don't want to hear what it is really like to live under these bans.
Right.
What I would want them to hear, though, is that 1 in 4 pregnancies end in miscarriage. And that medication that you need to help your body heal from a miscarriage is also used in abortions. I think they should also know that postpartum hemorrhage, what I had, is one of the leading causes of maternal death. And again, when you restrict the access, you put administrative delays or technical delays in between women and emergent care. And the United States already has the highest maternal mortality rate of any developed nation. So these bans are not making anything better. But I want to make sure that it is very clear. Of the women in the Zerwoski v. Texas case, there were 20 of us that sued the state of Texas. The majority of us had fatal fetal diagnoses, and we wanted our pregnancies, but we had devastating outcomes. And these aren't rare situations. The diagnosis may be rare, but there are more of us than you think. But we don't know how many families face this issue because we don't treat this issue like healthcare. We don't
Right.
track it like healthcare. So we don't know how many fatal fetal diagnoses there are. And I think just, again, when you restrict access of medication to everyone because you believe that they are having a bad abortion, you impact those people that are having your good abortion as well.
Yeah, and it's them thinking that somehow they know better than you and your provider about what's needed, what's important in their life. That's to me the thing that's so striking. Ms. Cassiano, would you like to add to this? I'd love to hear your thoughts.
Yes. So I just want to say that their job is for the people,
Right.
and they are lacking. They are not here to hear us. We are not a sacrifice. We are people. Our stories are real, and we matter. So if they were here, they would know that we are real, and we have real life stories. We're not a fairy tale. So if they did their job, they would know.
Well, thank you for that. And your voices are really powerful, and we will do our best to help amplify those so that more people hear. Ms. Jafo, and there's really for the rest of the panel. I'm really struck by how people, women, have they are driven to control their own bodies and their own lives. They will figure out some way of doing what it takes to exercise their freedom. Even when it is, as I think Alexis said, even when the barriers become intense, when the cost becomes so great. And I've seen this so much in my life and my career, including back in the day when I worked at Planned Parenthood myself, and I saw every day people walk through the doors of those clinics, perfectly capable of making the best decisions for themselves without needing any politician to tell them what to do. I'm really struck by the impact of all of this right now and the chaos in what is allowed and what isn't allowed when it comes to mifepristone and medication abortion, which has become such a crucial way for people to be able to exercise their freedom and control their own bodies. And so would any of you, could you comment a bit, just briefly, on what impact the chaos around what is allowed and what isn't allowed around medication abortion, how it's impacted the folks that you're helping to take care of?
Thank you for that question. The weekend last month where we thought we were not going to have as robust of a telehealth option for abortion care, it felt like Dobbs, like 3.0, 4.0 at this point. I feel like there's been other things.
Here we go again, around.
Yes. But I also felt, I will say, on behalf of the staff at the Chicago Abortion Fund and the providers that we work with in Illinois, that we were ready to handle whatever chaos was going to come our way. And I think that is because of the resiliency of our ecosystem in Illinois, but I also think it's because of what you said about our patients and the people that we support. I think the chaos is the point. We have been under chaos for quite some time now. The cruelty is the point. And our job is to affirm the legality of abortion access, the legality of your right to travel in this country. You are free to travel about this country for any kind of health care that you deem necessary for yourself or your family. And unfortunately, that is not an option for the vast majority of people living under the economic realities of this administration, but it is our legal right to travel. And I think that is something that we try to affirm for people as much as possible, that it is, we do have safe abortion in many states around the country. But I think their job is to sow chaos and terrify people.
That's right. Thank you. Madam Chair, I'll yield back. I know I've used more than my time, but thank you all very, very much.
Thank you. Senator Baldwin.
Thank you. I want to thank you, Senator Murray, and Senators Smith and Warren for bringing us all together today to highlight the really devastating impacts that the Dobbs decision had across America. I want to just share a little bit about my home state of Wisconsin. in Wisconsin, when the Dobbs decision came down, women in my state were sent back to really the 19th century, literally, to live under a law that was passed in 1849, 1 year after statehood, that was widely viewed as a criminal abortion ban in our state. This was 7 decades before women even had the right to vote. And that became the law of the land by virtue of the Dobbs decision. Now, Wisconsin's Supreme Court struck down that law in July of last year. And slightly prior to that time, they did start allowing access to abortion care in Wisconsin based on a lower court decision regarding that 1849 law. But the Dobbs decision had devastating impact in my state. The Trump administration and congressional Republicans have really made it clear that they're not going to stop until they've banned abortion nationwide, with all of these other things we've seen in the big ugly bill and many other proposals on the table. And they're trying to defund Planned Parenthood. They're trying to ban medication abortion, the most common form of abortion. And simply put, they're trying to stop women from controlling their own bodies. I refuse, for one, and for many in this room, to let this generation of women have fewer rights than their mothers and their grandmothers. And we won't stop fighting to expand women's rights rather than seeing them shrink. So even though abortion is legal in Wisconsin now by virtue of those state court decisions, Wisconsinites are only able to receive care in 3 counties. We have 72 counties. And that means in 69 counties, there's not easy access to care. And without access statewide, too many Wisconsinites have to drive hours, take time off work, arrange for childcare, face medically unnecessary barriers that are in state law before getting the health care they need. To Alexis's point, our rights are dependent upon location, zip code, all these other things. And that's why I introduced with colleagues the Reproductive Health Care Travel Fund Act. This legislation would provide women the support they need to access reproductive health care by providing grants to organizations, including abortion funds, to offset costs of travel-related expenses. So I want to ask Ms. Jaifo, thank you for meeting with me earlier today and to talk about this. You have personal experience in your organization of helping patients overcome the barriers to obtaining care. But how would passage of a bill like this help further support for patients?
Thank you so much for that question, and thank you for meeting with me today. I, as you know, had an abortion in Milwaukee and did have to navigate waiting periods and parental consent, and it was not a great experience. So it is my privilege to be able to help make that easier for our patients. The average wraparound support cost that we are currently seeing at the Chicago Abortion Fund is $700 per person. That is the average cost that it takes us to move just one of our patients around the country. So that could be train, plane, gas, childcare provision or a childcare stipend, meal support. And then the average cost for an actual abortion, the average amount we provide per person is about $560. So the travel is more expensive than the appointment itself in many instances. So a law like the Reproductive Health Travel Fund Act would ensure that we can make sure that the states that have worked really hard at creating conditions for their own residents to access abortion care, we can also make sure that other residents of other states can come to our states to access that care. We are going to be in this position for quite some time. And so making sure that we have an infrastructure that is sustainable, that is here for the long haul while we fight to get back the access, the very basic access we had under Roe is critical. So I would be very grateful for the Reproductive Health Travel Fund Act.
Another consequence of the Dobbs decision is the the educational institutions that no longer provide full training. So educational institutions in states with abortion bans have been forced to send their medical students out of state to receive training. As institutions in states where abortion is legal have to deal with a huge influx of healthcare professionals in need of training in abortion care. We've introduced the Reproductive Health Care Training Act, which would support training for healthcare providers in abortion care, including those forced to travel out of state due to these restrictions. And so you referenced this, Ms. McGill-Johnson. Can you share why ensuring abortion care training for providers is also essential in improving care for women nationwide?
Absolutely, and such an act would be so critical in this moment. Here's what we know. A year after the Dobbs decision, remember Dobbs was obviously June 24th, 22, and July 1 is when medical students, residents match into their programs. So we had actually an experiment, a full year, to be able to see what would happen when people chose their programs and their programs chose them and they matched into a program. We saw a 10% decline of OBGYNs matching into residency programs in banned states. A year later, there was a 20% decline in states like Alabama, again, because residents don't want to go where they may build a family, a life, and then begin practicing in a community that does not allow them to practice to the full extent of their beliefs or their or the law. And so they may choose it. They chose obviously to go elsewhere. We've also seen a decline in residents, medical residents, choosing OBGYN as a profession, and then high-risk maternal care delivery providers moving out of states. So the impact of not having the full training and then not choosing to be in states where you fear being criminalized, being fined, being harassed, all of the things that many abortion providers experience in states with bans and without bans. You can see the impact of that. So it is so critical that we don't lose access to the information, the knowledge transfer, and that we ensure that we are continuing to shore up the expertise and the skills that could be lost over this period of decline.
Thank you. Senator Lisa Blunt, Rochester.
Thank you, Senator Murray, Senator Baldwin, Senator Smith, and Senator Warren for hosting this spotlight forum to focus on the harms of the Dobbs decision. I also want to thank the witnesses, each and every one of you. I was listening in the back as well and heard your testimony, whether as a patient or provider or an advocate. I will tell you, I have a lot of pages here. And, when Ms. Kash said that this is your third year doing this hearing, it just made me hearken back to how long we've been fighting these fights. And there is a level of righteous indignation that I'm feeling right now. For everybody in the audience, I'm sure you're feeling it too. This is not about a television show or a book going back in history. Like, this is happening now. And as I sat here, I thought about the fact that I was a girl. I was a girl when Roe became the law of the land. Since then, my daughter and my daughter-in-law have watched the Dobbs decision happen. And I remember marching across from the House to the Supreme Court and marching back, playing Beyonce's "You Won't Break My Soul," because we will not be broken. But as I sit here, I carry on my phone a picture of my granddaughter. She is born now in a time when there was no Roe. And so I have a question that wasn't on my sheets, and you can all think about it while I ask other questions. But what do we need to do to mobilize and to get everybody to not forget. Like, this is fundamental. We're talking about 250 years as an American. This is fundamental to my own life, liberty, and pursuit of happiness. And so if there are ideas that you, or one lesson, something you want to impart that you want, if nobody remembers anything else you said today, they remember this one thing, think about that. And I'm going to ask my first question to Ms. Alexis Miguel-Johnson. The One Big Beautiful Bill prevented Planned Parenthood and other reproductive health providers from receiving Medicaid funding for 1 year. That year ends on July 3rd. Am I correct? I think, yes. And so how has the defund provision, how has that impacted access to reproductive health care over this last year? And what will be the impact if congressional Republicans decide to extend this provision permanently?
Well, thank you for both the moving reminder of your granddaughter growing up in a world that no longer has the protections of Roe, which we know was the floor, but also growing up, likely seeing her face in a world where the attacks have been so relentless. And in an organization like Planned Parenthood, we've lost 50 health centers over the last year, 20 since the defund provision went into effect. We have seen through, this year, support of Planned Parenthood frontline providers. They have provided $45 million worth of care to patients because they do not turn patients away. But we've still seen STI rates increase, family planning rates go down, our breast cancer screenings go down upwards of 25%. So very, very clearly patients not being seen, not being treated. If the defund provision, which we know the Republicans have a framework around, were to prevail in another reconciliation, we could see upwards of 150 more health centers closed. That largely would be in rural areas and medically underserved communities where Planned Parenthood health centers exist. So the impact of that would continue to be devastating. And we know that people would be denied care, they would forego care, or they would have to, as many of my panelists talked about, have to travel at great length to just get basic access to reproductive health care.
Ms. Keltika, the same question.
Thank you. It's an excellent question. It would be devastating. As many of you know, to provide health care in more rural settings is more costly, and that would force us to take a hard look at how we could preserve services in those areas if we weren't be able to get back into Medicaid funding. It would be devastating, and Maine Family Planning doesn't like to close things. That I mentioned earlier, we had the impact of closing those free primary care settings. That's not what we do. We're here to expand access and increase access and be able to serve Mainers, particularly in our more rural states, rural parts of the state. I know what it means to be able to go to a family planning center when you know you're going to get confidential care, because in small communities, you may not go to even your PCP if you have one, because you don't want to see your sister or a neighbor or someone there in that office. So I know how critical these care services are, and it would be devastating.
And if I could just ask the last three, the first question that I asked, if there was one thing you want to make sure you impart today. And could I start with you, Ms. Cassiana?
Yes. So first of all, I really want to thank Free and Just. And I say that because they give safe spaces for storytellers to tell their story and our reality. And then secondly, I want to say communication. It starts at our dinner tables, on the couches, in your own homes. You tell one person, another person tells another person. And when I first started this, I remember I told my husband that I wanted to speak louder. And he backed me, and he said, "Well, let's speak louder." And he's here with me today, right here, and and he was all for it, and for not just for myself, but for his other 4 children that we have here, and I appreciate that because it's hard, for men to speak loud, and he doesn't speak as loud as I am, but it's okay. I'm here for him on his behalf, and I think that's where. What's really important is that we start and just telling one person and one person telling another person, and we're gonna get there.
Communicate, speak louder. Ms. Cash?
I mean, I couldn't agree with her point more perfectly. As a storyteller, what I've learned is when you tell the stories and you talk about the real instances of what you went through, people begin to see the flaws in the legislation, but they also begin to have empathy, because it's a lot easier to have empathy with someone you're talking to. But I really think that, like, one thing that I want to make sure people understand is, like, I loved my child completely. You can love your child and you can still make a decision to end their pain. And I know that I am not alone. I know that there are families across this country that are in this same grief and silence, and they're too afraid that someone will decide to call them a murderer if they talk about their decision. I think the biggest thing is, like, pregnancy is not black and white. Parenthood is not black and white, but legislation is black and white. What I would want someone to know is, until you are in that room hearing that your baby's bones are going to break, until you are in that room hearing that your baby is going to suffocate at first birth, until you have went through what Samantha has gone through, you don't know what you're going to do. And it is so gray.
Thank you. Thank you. And Ms. Jaifu?
Thank you. Yeah, +2 on that. I think we need to say the word abortion. We need to stop using euphemisms. We have really, I think, ceded a lot of ground, cultural ground, to the right for a very long time. We have repeated their talking statements. We have lifted up complete falsehoods that they have pushed out, and we have said safe, legal, and rare when we should say safe, legal, and accessible. Abortion is a personal decision, but it doesn't just affect a singular person. The majority of people who have abortions in this country are parenting. This is an issue that deeply impacts families and communities, and the more, and I say this a lot, this is a kitchen table issue. This is an issue that intersects with so many other fights for liberation that we are currently experiencing, and we need to treat it as such.
Senator Warren.
Thank you very much, Senator Murray. And I want to say thank you for organizing this, and along with my co-hosts, Senator Baldwin and Senator Smith. So tomorrow marks the 4-year anniversary of losing Roe versus Wade. And in that 4 years, 21 states in this country have put in place either an outright ban on abortions or so many restrictions that they make it virtually impossible. And in those 21 states, instead of families and their doctors making really tough decisions, it's now a politician who's right in the middle of the decision and the principal one to call the shots. That's what 4 years without Roe versus Wade has brought us. Politicians who have a whole lot more power, and brokenhearted mamas and daddies, and doctors trying to practice medicine who all have a whole lot less power to get to the places that families need to be. So I'd like to start out, if I can, with you, Ms. McGill-Johnson. You lead Planned Parenthood, and you have called the defund policy that people have been talking about this afternoon just a backdoor abortion ban. So how is it that Republicans can threaten abortion access, even in states like mine, which protect access to abortion, but Republicans are figuring out how to block it? Can you say more about that?
Absolutely. Thank you, Senator Warren, for the question. I mean, clearly, this did not end with Dobbs. This did not end with their passion for denying us our basic bodily autonomy was not just about returning the decision to the states, to the politicians in banned states. It was about trying to find any and all means of limiting access to care. And so the defund provision in the H.R. 1 last year that was signed into law was designed to restrict patients from using their Medicaid insurance at Planned Parenthood health centers. Now, we know a lot of states, particularly those states with bans, never expanded Medicaid under the ACA, so they weren't able to, so at the time did not have the same impact. But many states that have abortion access expanded access to Medicaid, and is where many of our ability to provide access to abortion exists. So since that defund provision went into effect last year, we have lost about 50 health centers in 50 health centers over the last year, 20 since the defund provision. And so the impact of that means that the states where, where abortion access exists, are losing access to Medicaid funding, have lost access to Medicaid funding, while some have been backfilled generously by their states. It has impacted their ability to continue to provide abortion care in the same way. So that was why we called it a backdoor abortion ban.
So here's Donald Trump, who said in 2016, he promised he would defund Planned Parenthood as long as they are doing abortions. Can't pass a federal law to do that, can't do it through the political system, so finds the backdoor way to do it. But one of the consequences of this, I take it, is not only to defund abortions, but also to put other healthcare services at risk for women. Now, I put a report together revealing new data that since the bill passed, the number of breast exam visits at Planned Parenthood centers fell by 25%. 25,000 patients lost access to birth control, and nearly 75% of Planned Parenthood closures occurred in rural and medically underserved areas. So this is not just targeting abortions, this is targeting women's lives all across this country. Would you like to say more about that?
Absolutely. I mean, and again, that was the intent of the bill. The intent of the bill was to, was to harm women, right? It was to harm patients at Planned Parenthood, and it was to harm a provider that has stood up strongly and vocally against this administration's policies, right? So it was a targeted political attack, not only that had the consequence of also impacting millions of women across this country.
Right. So attack to the health of women and to silence the women who speak up on their behalf. And it's not just Planned Parenthood. Planned Parenthood has drawn a lot of the fire, but 2 independent clinics, Health Imperatives in Massachusetts and Maine Family Planning, have also been swept up in the Republican attack. And we are very glad, welcome, thank you. We have Ms. Kiltika, you lead the Maine Family Planning in one of the most rural states in America. President Trump and congressional Republicans have forced you out of Medicaid. Can you just say something about how that has affected the communities that you serve?
Well, so it's been effectively said, this has never been just about abortion. It's about creating chaos in whether or not patients can access any sort of sexual and reproductive health care. And it certainly impacted us in Maine. It is attempt to already put a strangle around what is clearly essential health care in what is in the midst of a healthcare crisis. So as I said earlier, we had to close 3 primary care practices in our most rural parts of the state, affecting 1,000 patients. And it's created disruption for our family planning patients. When Dobbs fell, and with this, and most recently with the Medicaid ban, and our patients heard about that, the phone was ringing up at our call center to say, can I still get access to care? What does this mean for me? To the point that generally, always personally, what does this mean to me?
Right. And if I can just slip in one more point here, while Republicans in Congress defund legitimate health centers like Planned Parenthood and Maine Family Planning, what are they offering instead? The Trump administration is spending your taxpayer dollars on a new government website called moms.gov that claims to help new and expectant mothers, but in fact is promoting anti-abortion crisis pregnancy centers. Ms. McGill-Johnson, I've run over my time here, but can I ask you, just to make the point, Is the Trump administration steering women to real healthcare providers?
In limited time, no.
Can she have a minute more?
Crisis pregnancy centers do not have the same obligation to speak the truth and to give medically accurate information to women. So they are steering dollars, taxpayer dollars, to misinformation and is harming women in communities.
So it's misinformation, but does anybody get hurt by this misinformation?
Yes, people get harmed all the time when they are not allowed to make decisions about their own bodies, when they are being, given kind of fake ultrasounds about where they are in their gestational period, and then being delayed access to real abortion providers when they have stated that that is what their preference is. So yes, they are being harmed.
Yeah. So look, here's the good news. Republicans in Washington are trying to sneak through these backdoor abortion bans because they know that the American people are not with them. The voters don't like their extreme agenda. If they liked the agenda, they'd be out here doing it in public. Instead, it's these alternative ways. And because they know we have the power to push back, and that's the part we have to remember. What's happening is terrible, but what's also happening is that we are more and more determined than ever to push back. Decisions about abortion should be made by the patient, the doctor, the family that the patient wants to bring in, and not by some politician off in Washington or some state capital. And that's what we're going to keep fighting for. Thank you. Thank you for being here.
Thank you. Senator Blumenthal.
Thank you, Senator Murray, and thank you for bringing us together today. Thank you to all the brave and wonderful people that we have before us today as witnesses and in the audience. And you've probably already been told, but let me just repeat that more people are watching this Spotlight Forum than would ordinarily be watching a formal committee hearing. Believe it or not, that's one of the ironies of Republicans refusing to give you and others like you a platform publicly so that we would be sitting up at that dais and you would be sitting here and we'd be having the formality of a hearing, but the substance is equally valuable. So I thank you for being here today. I want to thank particularly the advocates. I first became involved in this issue when I was law clerk to Justice Harry Blackmun on the United States Supreme Court. It was the year after Roe v. Wade. He had just written the opinion, and it seemed like this whole issue is settled. Nothing to worry about here. And what we've seen, just to emphasize the point that Senator Warren just made, is ups and downs, but the arc of the moral universe on this issue bends toward justice. And that's why the American people are on our side. And I've seen the ebbs and flows. I've written as a state legislature the first state law that incorporated Roe v. Wade protections into our state statutes in Connecticut. At the time, people said, why would you worry about Roe v. Wade being potentially undermined? And the same with the Women's Health Protection Act when we first introduced it 15 years ago. Roe v. Wade's established law. Nothing to worry about here. I want to emphasize a point that I think is very important. Regardless of what the law is, it has to be enforced. It has to be made real for people. My former fellow Attorney General, Senator Cortez Masto, knows this point very well. The Freedom of Access to Clinic Entrances, or FACE Act. I was the first law enforcer to go to court to protect the women who were escorting other women. Sometimes men were escorts too, because they were facing harassment and intimidation outside of healthcare facilities. When I say intimidation and harassment, I mean physical, in-your-face threats and harassment. So I'd like to emphasize this point that Congress has to continue to examine how to protect access in real time for real people against real threats when sometimes local or state police are not sympathetic. And when these kinds of misconduct can be real barriers. Ms. Kiltika, you've been doing this work for a while, and I wonder if you could describe the type of situations parents and staff at your clinic dealt with before and maybe now after the FACE statute was enacted.
Thank you. We have seen an uptick in demonstrations and protesters, particularly in our more rural sites. As I mentioned earlier, many of our health centers are in the more rural parts of Maine. And when that happens, it's scary.
And obviously, there are some politicians who want to repeal the FACE statute. What would you say to them?
I say, please come and see what it's like to walk across the picket line being yelled at and called names when you're trying to get essential health care.
Thank you. Well, again, in deference to my colleagues, I'm going to follow the time limits here. My time has expired, but I can't thank you enough for being here. And again, Senator Murray, thank you for bringing us together.
Thank you. Senator Klobuchar.
Thank you very much, Senator Murray, and thanks for holding this important spotlight hearing. Good to see all of you. I guess I'll start with a discussion that we were just having on rural, but really all providers. And one of the things that's happened in states like Illinois and states like Minnesota is that when you're surrounded by other states that have banned abortion or have tried to ban abortion, you become the refuge state. You become the state that people travel to. And we have had this situation happen in Minnesota with the Red River Women's Clinic and was in Fargo and just moved over to Moorhead. Luckily, they're right next to each other, and it's just a drive across the Red River. But that is one example of how we've stepped up, and a majority of the patients actually come from North Dakota still. And how has the Supreme Court's decision, Ms. JFO, how has it impacted the work of organizations like yours in a state like yours, Illinois, that connects women to care and creates, I'm kind of answering it myself, which senators tend to do, but has an impact on some of the states that are providing the as well. Go ahead.
Yeah, absolutely, and thank you for your leadership in Minnesota. Minnesota abortion funds, including our justice, do incredible work for Minnesotans and for people traveling to Minnesota every day. So we're very proud to be a Midwestern state alongside you. But yeah, our work has changed drastically. In 2019, the year that I began as executive director at CAF, we supported in 2018, we supported 183 people that year, and last year we supported over 20,000. So that is a staggering jump, and that is really reflective of bans that started proliferating across the South and the Midwest in 2019, kind of paving the way for SB 8 and then for the Dobbs decision. I think it is really imperative for these receiving states like Minnesota, like Illinois, California, New York, were states that are, New Mexico, that are receiving large numbers of people traveling, to do all that we can to make sure that the laws we've created in those states are accessible to all and not just accessible to people who have the means to get on a plane. And that's probably the biggest change. Our job is to make healthcare access equitable at a time when it is deeply inequitable.
Completely.
But yes, the infrastructure support, I think, is most important, and operationalizing legality so that all people can access healthcare.
Thank you. Ms. McGill-Johnson, Dobbs has not only reduced access to sites, it has also caused some healthcare providers to rethink practicing medicine in certain states, threatening access more broadly. It's not just about abortion, it's really threatening all reproductive care if you don't have the OBGYNs. And since Dobbs, we've seen reductions in OBGYN and even other medical residency application in states with bans. Talk about these maternity care deserts across the country.
Well, I mean, in a state like Georgia, where, a third to a half of counties have only one OBGYN, imagine what that experience is when you are just, again, trying to be pregnant and determine the best pregnancy outcome, and you don't have access to the just basic medical care in your community. The impact that has on someone. I've just a point of a personal privilege. I'm traveling with my 11th grader right now, who is a rising senior, looking at colleges and the number of questions that are coming up for her around what it will be like. What would it be like to go to a school where she no longer has the same rights? Conversations that we've had over the years since Dobbs with many corporations around the impact of bringing employees into their into states that they are deciding to move to. So when you lose access to OBGYN care, when you lose high-risk maternal mortality care, or maternal care, when you lose access to medical residency programs in states with bans, you're really changing the fabric of a community. And I think all of that needs to be understood when you look at the impact of Dobbs.
Okay, thanks. Ms. Kash, did you want to add at all to that in terms of what you're seeing with medical personnel or ability to treat women with other services in places like Texas?
Yes, I would want to say that I had 4 pregnancies in 2 years, and at not a single appointment did I not see the pain in my provider's eyes that they could not help me. They knew what they needed to do. They wanted to do it, but the penalties are so high. 99 years in jail in Texas. And so you have doctors that are living in fear and confusion. The state has claimed they're going to clarify it, but it's an hour-long continuing education training. And again, pregnancy, there's so black and white. There are so many different levels and things of pregnancy care that it is not always going to be such a simple decision. But doctors can't use their medical judgment. And so it's impacting the standard of care across the entire reproductive spectrum.
Thank you. Thank you. And thank you to the 2 other witnesses here that I wasn't able to ask questions, but I see other senators have arrived, and you can see the interest in this topic today. And I wish that our colleagues would have had official hearings about this. But as was mentioned, there's a lot of people tuned in that care very much about this. So thank you for your leadership, all of you.
Thank you. Senator Cortez Masto.
Thank you. I too want to thank Senators Murray, Baldwin, Smith, and Warren for putting on this important forum. And thank you to the incredible witnesses. Thank you for being here. Thank you for having the courage to be here and tell your stories and advocate on behalf of others. It is not easy. In the 4 years since the Supreme Court's conservative majority overturned Roe versus Wade, we have seen a 9% increase in pregnancy-related deaths in states with abortion bans. 9%. 9%. That is why it is so critical. Until we can overturn Roe, reinstitute Roe versus Wade and its progeny, it is important that we actually have states across the country that are safe havens for women, like we have been talking about. And I'm proud to say that Nevada, my home state, is one of them. In 1990, believe it or not, in 1990, and then again in 2024, in Nevada, a large majority of Nevadans voted to codify abortion rights. And we are not a blue state, we are a swing state. And this was supported by Democrats, Republicans, nonpartisans in my state, because we truly believe women have a right to reproductive freedom. And by the way, to access 21st century medicine. That's what this is about. And so I thank you for being here, because what I'm also finding, and this is the start of my question, I think, Ms. GFO, to you, even though we are a state that protects a woman's right to choose, other states are trying to pass legislation that actually has a chilling effect from those women from traveling to our state, or a chilling effect on individuals who want to help those women,
or even trying to criminalize my doctors for helping those women. So that's why I was pleased to, with my colleagues and with Senator Murray and many of my colleagues, to introduce the Right of Women to Travel for Healthcare Act. This is the very reason. Would you talk a little bit? People don't realize that as states where women can freely come, because other states are trying to pass legislation to criminalize doctors or criminalize, like in Texas, others from helping women, it has a chilling effect for them coming to states like Nevada. Do you mind talking? Are you seeing some of that in Illinois as well? I'm curious.
Yes, I think we know that abortion funds have had to shut down for periods of time because of decisions in their state trying to restrict their ability to do this important work. Right now, all abortion funds in the country are able to operate, but I think particularly for states like Texas, that is something that is continually top of mind. How can we do our work safely? How can we make sure that our staff is protected? And how can we make sure that our callers are protected? And that our callers know that they have the right to travel, that it is something that cannot be taken from them. That doesn't I think it is important to mention, though, that women, and particularly Black and brown women in this country, are often criminalized for pregnancy outcomes like a miscarriage. And so there is, I think, a deep fear, a rightful fear that people have, and our case managers often will get asked by our callers, if I get pulled over, do I have to tell them where I'm going? Mm-hmm. No, you don't have to tell them where you're going, that they can assure them that it is safe. We've done things in Illinois, and I know other states have done similar actions around license plate readers, making sure that that is not accessible to out-of-state bad actors. A lot of states have incredible shield laws, but I think this Freedom to Travel for Healthcare Act is really important to protect that constitutional right to travel for this very time-sensitive, highly politicized, highly stigmatized healthcare.
Yeah, and I think it's important as we're having this spotlight hearing. Many people think, oh, the issue has come and gone, and it's really not an issue anymore for women. But people are losing their lives.
That's right.
And there are states, even though the Republicans claim and Donald Trump claims it's a states' rights issue, it's not about that. They're trying to actually take away everyone's rights, including states like ours, right? And having this chilling effect. And I just. And it is such an eye-opener. Many people need to understand how nefarious it is to take away not just the laws, but to take away the funding and then criminalize it and then turn neighbor against neighbor in civil actions. I mean, how evil is that? Are we really talking about? And so, Alexis, I wanted to talk to you about Title X. Title X funding. The Trump administration has withheld millions of dollars in Title X funding for months. And then this year, they delayed for months releasing the application that grantees used to renew this crucial funding. Community health centers and public health providers in Nevada were concerned they would no longer be able to provide certain reproductive health services if they couldn't access those Title X funds. Can you expand on the difficult choices that reproductive health providers who rely on Title X funding, like Planned Parenthood health centers, the difficult choices they have to make when faced with these delays and uncertainty?
Yeah, absolutely. I mean, Title X is the nation's largest federal program for sexual and reproductive planning, and it allows a provider to offer patients service without charging them, right? Many patients don't even know that they are receiving Title X funding. They're just able to come in, and providers are able to make the decision with those funds to be able to treat them according to their need. That's an incredible privilege and luxury to be a part of a social safety net that respects the choices that patients are making and also ensures that they are being able to get the care that they need. So when the administration delays access to those resources and providers, health centers have to make tough decisions about how to staff, how to make allocations to resources to ensure that they can see as many patients as possible for as long as possible, that becomes a constraint inside the community. When the administration tries to impose things like, as they did in previous years, a gag rule on providers to not allow them to counsel or refer to abortion and to have doctors essentially provide a less standard of care than they would otherwise, it puts providers in a bind. And so the ways in which this administration is using its resources, both through the defund provision that we just experienced, through the One Big Beautiful Bad Betrayal bill, as well as the delaying of Title X, it's a way to use federal resources, taxpayer dollars, to take away access and further limit, the ability for low-income patients to receive care.
Doing everything they can for a federal abortion ban. Thank you. Thank you all for being here. So appreciate it.
Thank you. We will then now turn to Senator Hickenlooper and then to Senator Whitehouse.
Thank you, Madam Chair. Thank you all for being here. My mother was born in 1921, was unlucky, was widowed twice before she turned 40 and raised 4 kids by herself. And a year never went by where she didn't make a contribution to Planned Parenthood, because she said she could not imagine a harder burden to do to a young woman who didn't come from resources than burden them with a child without the opportunity to plan their family. And I am sympathetic to what all of you have had to deal with over this period. I want to bring up an interesting point here from the West. In this past January, the Wyoming Supreme Court found that the state's extreme laws banning abortion, including access to medication abortion, violated their own state constitution. In 2012, following the passage of the Affordable Care Act, Wyoming voters felt so strongly about the encroachment of politicians into individual health care decisions that they adopted the right for adults to make their own health care decisions into their state constitution. The hypocrisy of the attacks on personal reproductive freedom in Wyoming and everywhere is breathtaking. As the Wyoming Supreme Court noted earlier this year, abortion bans directly violate an individual person's ability to make their own health care decisions. I guess, Ms. Johnson, I'd have a question for you. The decision in Wyoming is certainly good news for the people of that state. It's also good news for the people in our state. We're neighbors. After the disastrous Dobbs decision, states like Colorado that have protected access to abortion care saw large increases in out-of-state residents seeking access to abortion care. This put a strain on all the providers in our state. It's why access to medication abortion through telehealth is so critical, so important. And I guess I could ask each of you this, that while Colorado has protected access to abortion, if the Trump administration makes a political, non-scientific change to medication abortion, which they're obviously considering, it's not going to matter what state you live in, everyone's going to lose out. So we'll start with you, Ms. Johnson, but each of you, how do you think that states like Colorado in particular will be impacted by a change to prescribing rules for medicated abortion?
Well, as you said, I mean, everyone will be impacted by it, and the majority of abortions currently are done through medication abortion, right? And so when you lose access to prescribing that through telehealth, when you have sham reviews by the FDA put forward to try to find misinformation on a medication that has been delivered successfully to millions of people for decades and has been peer-reviewed 100 times or more, it will impact the ability for people to get care. For Colorado in particular, right? Where Colorado sits in the country, right on top of Texas, with the number of patients who are traveling from states across the South and in the Midwest, it's an important hub. It's an important oasis, just as Illinois and other states are in the Midwest. Colorado plays a really critical, important role, particularly in the Planned Parenthood network. And so it is very important that we continue to be able to provide access to medication abortion, and that the patients who are traveling upwards of 18 hours by car just to get access to medication abortion in return are able to get that.
Thank you. Kiltaka?
Thank you, Senator. That's an excellent question. And even though Maine had the wisdom in 1994 to pass the Reproductive Access Act, so we were able to continue to provide access to legal abortions in Maine. If this ban happens, as noted, Maine does provide the majority of our abortions are medication abortion, as because we are such a rural state, telehealth is essential to making that service available, so people can make the personal choices of when they want to have their abortion. They don't have to come in on the day. So that's the other part about being access to medication abortion, is the ability, the freedom for a person to say, I'm off over the weekend, or I have childcare, so I'm going to take the medication then. So it would be devastating. And also, remind that this medication is also used for other medical reasons. So miscarriage management, pregnancy loss would also be impacted significantly if we lost access to these medications.
Absolutely. Ms. Jaffa?
Both of you said it right. I think we also know that misoprostol is a safe way to end a pregnancy. And so I think what this speaks to is they're going to keep doing all that they can to restrict, and we're going to do everything within our power to figure out ways to get people the health care they so desperately want, need, and deserve.
Right. And I think I'm out of time, so I...
Thank you. Thank you. Right. Senator Whitehouse.
Thank you very much, Senator Murray, and thank you to the panel for being here. I wanted to ask a little bit, Ms. Johnson, if you don't mind, about the role of judges in advancing the agenda to strip these rights away from women. We've obviously lived through the confirmation, for instance, of Brett Kavanaugh, where that was a very significant issue. And after discussions with Republican colleagues, he was voted onto the Supreme Court. We were told that he was not going to be the decisive vote against Roe versus Wade. And sure enough, that was not true. And he became a deciding vote in that case. Could you tell a little bit about what you might call the weaponization of the judiciary to accomplish the ends of the movement that desires to take these rights away from women?
Absolutely. And what you're speaking to, Senator Whitehouse, is the long game that the opposition has played, right? They held a long view around ending access to abortion, and they played a very long game. Started with taking over state houses, state by state, to create these targeted restrictions against abortion providers. And in the last administration, President Trump, or his last term, appointed 200 horrific anti-abortion judges to the judiciary, and that continues now. I'm thinking in particular of Josh Dunlap, who was just recently confirmed, right? You expected a judge to be impartial, to be able to hold their own ideology over the merits of a case. And in fact, we have people who are being appointed through party line votes who have been active advocates against abortion rights. And so the weaponization of the judiciary, which should be fair and impartial, again, being able to decide on the merits of a case, now we no longer have those safe spaces and neutral spaces to have the kind of deliberations around our freedom. And so the impact has been really, really quite devastating, starting with that decisive vote with Brett Kavanaugh, knowing that, we knew that would be an issue, even though he said it would not be. And now we are living the consequences 4 years later.
He didn't fool everybody. You mentioned Joshua Dunlap. Joshua Dunlap is on the First Circuit. I'm a Rhode Islander, so we are in the First Circuit. So it's notable to me when a candidate pursues a judicial office that affects Rhode Island so directly and comes to that office with a demonstrated history of bias against women's reproductive rights. Just to give one specific example, he supported a piece of legislation that would have given a cause of action for wrongful death in the event of the death of what the statute I think called an unborn viable fetus. Now, in theory, the statute protected abortion rights by saying that if the abortion was medically necessary, and if all the proper consents were available, then there was a defense against that. But in real life, what does a law like that do in terms of chilling effect on women's decisions?
Well, it's a pathway to try to create a personhood, right, for a fetus, and in doing so would create a pathway to criminalize every pregnant person, to criminalize every provider, anyone who supports someone seeking access to abortion. It would be incredibly dangerous to have that kind of provision and build that foundation for a record that we would anticipate would go to a Supreme Court, one that exists right now that could weigh in favor of it.
And it requires, presumably, the physician to be absolutely the guarantor that every I was dotted and that every T was crossed with respect to consent and any gray areas around the lawfulness of the abortion. And that puts a fairly significant shadow over the practice of the physician, not to mention the woman herself.
Mm-hmm. Every provider, every hospital administrator, every lawyer inside of the hospital, every hospital board, every clinic, every clinic board, every single person involved in your private medical decision. It's exactly how that would happen.
Yeah, so it was unfortunate, I think, that individual was in fact confirmed. As I recall, it was on a pure party line vote, and it was a novelty, I guess, in the First Circuit. Maybe other circuits have seen that kind of judge appointed, but this was different, and this was unfortunate. So thank you very much.
Thank you. We will go to Senator Duckworth, and then Senator Rono, and then Senator Cantwell.
Thank you, Madam Chair, and thank you to our panelists for being here. And we deeply appreciate you and how you're telling your stories about how Dobbs' decision has impacted so many people's lives. When Trump's right-wing extremist justices in the Supreme Court threw out our constitutional right to choose if and when how to have a baby, they did more than just ban abortion. They put women in danger. They increased the maternal mortality rate because doctors are afraid to provide life-saving care to pregnant women who are bleeding out or suffering deadly infections. They crushed the dreams of hopeful parents who live in abortion-banned states and cannot access to IVF treatments. They need to build their families. They ripped away the freedom to choose from our nation's service members and veterans who have sacrificed so much to safeguard the freedoms that we cherish. And they won't stop there because the Dobbs decision created a roadmap. It created a roadmap for Republicans to undermine the right to contraception, with over 80%, which over 80% of Americans support. And I've visited some of our abortion care providers in Southern Illinois, and they tell me they have women getting on Greyhound buses from as far away as Texas to come to Illinois to have an IUD implanted because their doctors in Texas refuse to give them an IUD because of personhood fears. So in short, the fall of Roe has made us less safe, and combined with a cost of living crisis, it's forcing people to make impossible decisions like putting food on the table, paying for gas, or finding childcare. Ms. Jaifo, thank you for coming. The work of the Chicago Abortion Fund is so critical these days. Again, we in Illinois are very proud to be a safe haven for those seeking reproductive care inside and outside our state. 1 in 4 people in the U.S. Traveling for abortion care actually rely on Illinois on coming to our state. This means that the Chicago Abortion Fund is often people's only hope to get the reproductive health care they need. Can you talk about the obstacles, including financial obstacles, that people need help navigating when they reach out to you? Other than the cost of an abortion itself, why is it so expensive? Because I'm hearing that our clinics are spending upwards of double per patient what they have spent in the past.
Yes, I think with rising costs, and first of all, thank you for your leadership and thank you for talking to me. I love you so much. But I think as costs have risen around the country, abortion providers and people who need access to abortion and also need these very basic needs that families are struggling with so much right now, it is all compounding to make for a very expensive both cost for an appointment and cost to get to your appointment. And I think we're going to continue to see costs rise when we are choosing at the federal level to pay for a war while stripping healthcare from millions and millions of people in this country. We are showing where our values are, and our values are not with providing safety nets for families that are so much struggling. And I've said this a lot today, but I'll continue to say it. The majority of people who have abortions are parenting. Parents are struggling right now. There are so many things that parents need in order for their children to just survive, let alone thrive. And we are not giving them the basic things they need to survive. So when I think about being able to help someone access an abortion through a case manager at the Chicago Abortion Fund, I know that it is not just that person that is being impacted. It is their entire family. Some quotes from our callers. Thank you so much for this help. I will work hard every day to be the best mother to my son, and thanks to this donation, I can focus on my son's well-being and graduating nursing school. Another one said, words cannot express my gratitude. In the midst of all this political chaos and personal turmoil, having a source like you made me feel safe to be a human being in this country again. And I said 142,000 people traveled for abortion care last year. Every single one of those people has a very particular story and had real needs. And I'm very grateful that we are able to provide a lot of those needs in Illinois, but know that there are so many that we are not reaching. And so I thank you for the opportunity to speak at this forum to be able to reach more people and for all of your leadership.
Thank you. And some of the stories I've heard is that, women who before could contribute $100 or $200 to their care can only give $50 or $25, and because of the rising costs, and it is really, really difficult for folks. So thank you for the work that you do. I yield back, Madam Chair.
Thank you. Senator Rono.
Oh, what can I say? Really, thank you so much for coming in and testifying. And of course, I especially want to thank Samantha and Kaitlyn, Samantha and your daughter. So, after Roe, it's hard to believe it's been 4 years, but the anti-abortion people out there have not stopped in their desire to place ever more restrictions and to get many more states to impose restrictions on a woman's right to make decisions about her body. So the fight goes on, and there are many outstanding lawsuits that are pending before the Fifth Circuit on mifepristone still, and plenty of other instances where the continuing assault on a woman's right to bodily autonomy continues. So thank you so much. I did want to just point out there are a number of clinics. So this is for Alexis, Planned Parenthood. A number of clinics closed as a result of the inability to get Medicaid reimbursement for 1 year. And still, some 20 clinics closed because they were relying on this reimbursement mechanism. So are these clinics that serve thousands and thousands of people, by the way, are they going to reopen, do you think, after July 3rd when supposedly they are able to seek reimbursement once again?
So it's a great question. It's an incredibly difficult decision to close a clinic, which millions of dollars has oftentimes gone into opening and retrofitting and ensuring that patients get the highest quality care possible, hiring staff to be able to ensure that all of the appointment slots can be met. And so when an affiliate CEO of ours makes a difficult decision to close a clinic, it comes with all of those considerations in effect. Just being able to reimburse Medicaid doesn't allow for a leader to just open up a clinic like that, right? And so the harm that we have seen from the Medicaid defund with just 1 year, even though we know they want to continue and go on longer, has been devastating for Planned Parenthood affiliates across the country. When you have, it's been 50 over the last year, 20 just since the defund provision, but every time a clinic closes, it means that someone has to drive further to get access to care. It means they can't go around their corner on their lunch break and get an STI test or a breast cancer screening or get access to to family planning. So I wish it were as easy as just turning the light switch back on, but there are some really difficult decisions that had to be made, largely in rural communities.
I think the people who pushed for this one-year ban knew what the likely long-term effects would be, that you can't just snap your fingers and suddenly these clinics will resume. And in fact, people should also understand, as long as we're on the subject of reopening hospitals and clinics that will be closed because, again, so many restrictions on Medicaid reimbursements that is in the big ugly bill, that there are already a lot of hospitals and clinics that are having to think about or have already closed. And so millions of people in our country will not only lose their health care, but it's not as though these clinics and institutions will reopen, just as what happened with Planned Parenthood. For Evelyn, you run the main program. You managed to continue the program even if you were not able to get Medicaid reimbursement. How did you keep going? And are you going to start asking for reimbursement once again? I assume you are after the July 3rd date. But explain what you had to do to keep going and providing the services that you provided in Maine.
It's been difficult. It's been chaotic. While we had to close 3 of our primary care practices in the most rural parts of the state, and that took a big toll on our staff as well as the patients we needed to transfer to other practices. So, but we have been able, through our limited Title X, we were out of Title X for 5 months, got it back in September of 2025. So we were able to, with those limited funds and our limited resources, to continue offering family planning services throughout our 18 health centers.
Thank you for continuing to run the program. Samantha, you have testified that when you were pregnant, you were so afraid to even bring up potential options, et cetera. And is this something that also is impeding women who live in Texas in particular from seeking the kind of medical care and assistance that they need?
Yes, I mean, just listening to
What
you.
kind
I
of
feel-
fear did you go through in even seeking appropriate medical care?
Just listening to you ask me the question, my heart is racing. My husband and I, we have 4 children. So my children need their mother. And my husband for sure needs his wife. Trust me, he does. So there was, it's a lot to just sit there and think, like, my doctor, she gave birth to my last 3 children. So knowing that she had to kind of choose, her life or mine, that's scary for her to think, well, I might have to go to jail, or, how am I going to feed my children if I don't have my license? Well, what about us? How am I going to be a mother for my child? So just the entire situation is scary. And to think of, going out of state, which I do think the states that offer this care, because without you guys, many of my loved ones and friends would possibly not be here today with me, and their support means a lot. And without you guys, it's scary to even think about not having the support from our neighbors.
Senator Miller, thank you very much for calling us together. And even as we speak, the Republicans are putting together various unanimous consent bills that will impose ever more federal limitations on a woman's right to seek reproductive care, including preventing students at our universities from getting the kind of range of information that they should have. And there's an actual bill that would require universities and colleges to provide how to say pregnancy to term. That's what the focus is on, not on the full range of reproductive care that students should be able to avail themselves of. And that is how far they want to go, to force their ideological views on students. So you can imagine all of us will be taking our time on the floor to protest these UC requests. Thank you, Madam Chair.
Thank you. Senator Cantwell.
Thank you, Senator Murray. Thanks for getting this organized and for your constant leadership here. Very much appreciated. And to the panelists, thank you so much for all your stories. They are so heartfelt, so meaningful, and your advocacy means so much. I wanted to talk about our state, Washington. In 2024, my office released a report that showed that out-of-state abortion patients went up 46%, and abortions provided in Washington state went up 23%. We've also documented that at least one woman is being airlifted to Washington per week due to pregnancy complications. So we literally are, on the front lines. Some, Idaho, is our neighboring state, doesn't provide this care. Some OBGYNs have begun recommending that their patients purchase air ambulance insurance just to be ready. And it's clear that women are having to travel further, shoulder the cost and the healthcare risks. And I don't think anybody explained this to anybody, that this is what exactly we were doing. So my colleagues have done a good job of talking about the care, but I don't think anybody is talking about the cost. And it really, talking to providers in the state of Washington, the phone calls that they get, it's crazy when you listen to the phone call. They're like, is there a hotel? Is there bus service? Is there this? Is there a place where my child? They are literally parenting, trying to deal with bringing that child with them, trying to deal with their care, trying to say, am I going to keep the cost down? How can I do this? And I'm pretty sure by most definitions, this is called what? Catastrophic care, because you're paying 1/3 of your monthly income just for this care. So I wanted to know, Samantha, I was incredibly touched by your testimony. Thank you so much for being here. You truly are brave, and I'm sure your husband does need you. I'm sure he does. And to talk about Halo, thank you so much. So we've heard all about the role that Texas is playing on this abortion ban, but what are the additional costs that you incurred by carrying Halo to term, and what are the issues that you've had to face, financial burdens, if you want to share that?
So with our financial burden was we have a landlord. She's not going to say, oh, you have a funeral coming, you don't have to pay your rent. No, we paid our rent with our late fees. We had to crowdfund, and we asked family, friends, and everyone. We had help with NPR, a reporter that attached our GoFundMe. We had a nonprofit organization help us bury our daughter, and that's involving the embalming, that's the casket, that is her funeral service itself. All of those fees, they just kind of stacked up, and we were lost. We didn't know what to do, and we had to ask for help. And as we were raised, you work hard for everything you have, and my husband works really hard for us, but for him not to be able to cover these things by himself, it was hard for him, and both of us to ask for help. And the fact that we did was heartbreaking, that we couldn't do it on our own. But we did have to ask for help for our funeral, her flowers, everything.
It's so sad, so tragic. I'm so sorry. I'm so sorry for you and your family. Thank you for being here. Thank you for being so brave. Kaitlyn, did you want to talk about the financial burden, your cost in traveling, the risks to you and your family?
Yeah, it was obviously devastating, but we were so grateful that we had the privilege to be able to leave the state. It happened to be right after COVID, and so we had a lot of flight points that we hadn't used. We were able to book last-minute flights. We were able to stay with family that I had there. I had a boss that was willing to give me 2 weeks off while still paying me. I had someone to come stay with my son and my dogs. Literally every single day, it was another, what are we going to do about this? And we had an incredible support system to get through that. And I cannot imagine what families are going through when they don't have access to all of those things. You're taking someone who is already dealing with so much, whether it is an abortion for a fetal anomaly or it is just because someone is not ready to be a parent. These women you're compounding trauma on trauma, and it is leaving a devastating mental health care trail. There are not days that go by where because I was not able to talk to my doctor before I went to the appointment, when I walked into the appointment that morning, my husband wasn't able to be there with me. I was asked, do I want to, get my baby's footprints? Do I want to keep my baby's remains? I had no idea I was going to be asked those questions. I was not ready. I just wanted to be at home with my dog. I just wanted out of there. I wanted to not hit the protester with my car on the way out that had called me a murderer. And I didn't ask to do anything, and I regret that every single day that I didn't say goodbye to my baby the way that I wanted to.
Thank you, Kaitlyn, thank you. Alexis, this issue economically, where states are trying to, I'm sure employers are trying to say, I'll cover you, but I mean, that, I think it's something in 1 in 5 job seekers are saying, don't send me to any of those states. So we're literally, not only are women being denied great opportunities, they're also saying, I don't want to go there. And it's basically having an impact on, relocation and cost. So women are bearing these unbelievable tragedies in their life, but they're also bearing all this extra cost because somebody promulgated this rule on our healthcare system. Are you seeing that more broadly across the United States?
Yeah, absolutely. And I mean, look, for those who have the benefits in their employment packages to travel, they may even be more reluctant to ask their employer to say, hey, I need to go out of town and access this benefit, right? Those are the privileged few who, live or work in an environment where they actually have a healthy benefit package that allows them to do that. The real impact, obviously, on the Dobbs decision are for those patients or travelers who don't have access to those same benefits. People who have to take off a day of work, who may not get reimbursed for that, or have to leave at the end of a shift, and also navigate all of the challenges that many of my colleagues up here have talked about, getting access to childcare, elder care, and to think about, on the other side, from the clinic side, how to support those patients when they arrive. I've been in many a health center where a nurse practitioner is just, carrying a toddler around, and a makeshift playroom to ensure that they are well attended to while their parent is in recovery, and ensuring that they are seen in all all hands on supporting every single patient who comes through those doors. And so, as was said earlier, we will continue to make a way out of no way and support each other as best we can. But the fact that this legislation has put us into a space that we have to is actually what is criminal.
Thank you.
Senator Shaheen.
Well, thank you, Senator Murray, for organizing today's hearing. Thank you to all of my colleagues who have been here to testify, and to each of you who have been willing to come and give your time and address the real obstacles that women face because of these law changes. We really appreciate that. And as I was sitting here, I was looking at the audience and at the fact that most of us here are women. There are a few exceptions. They're husbands and good men, and there were some of our male colleagues who were here. But I think one of the things that often gets missed, because it's women who are directly affected, is that this is not a women's issue. This is a family issue. It's an issue that affects husbands and fathers and sons, and we need to talk about it in that way. And I appreciate, Samantha, that you talked about your husband needing his wife, and Kaitlyn, that you talked about the challenges that you and your husband faced. And I know everyone here understands that, but it's a message that we need to get out to the broader community so that people know it's not just women who are affected here. In New Hampshire, the state that I represent, it's been really difficult for our family planning providers to continue to provide the reproductive care that Granite Staters rely on. We have barriers at the state level. Congressional Republicans used H.R. 1 to decimate the operating budgets of Planned Parenthood health centers. They've prevented them from receiving Medicaid reimbursements for the last year. Alexis knows that this is going on. Fortunately, despite these kinds of obstacles, Planned Parenthood of Northern New England has not only survived, but it's continued to expand access. I worry, however, that our clinics in New Hampshire will ultimately not be able to withstand continued attacks by the Republican legislature. So I wonder, Ms. McGill-Johnson is President and CEO of Planned Parenthood. Can you talk a little bit about some of the best practices that you've been able to engage in your health centers across the country as they've been faced by these devastating loss of Medicaid reimbursements and other cuts?
Yeah, absolutely. And like every provider, Planned Parenthood health centers are facing rising healthcare costs and provider shortages on top of all of these Medicaid cuts and so forth. So cutting costs has been a one critical way in which we have tried to ensure access to care. Having access to telehealth appointments has made a huge difference in being able to not only continue to see patients in difficult to reach areas, but also, to ensure that as patients are traveling to New Hampshire, traveling to Maine in order to get access to care, that they are able to be seen in person, while oftentimes the person who is getting the telehealth visit may be in state or down the street. State backfills have been incredibly important as well, across the country, everywhere from, Washington to, today we have seen incredible support from our colleagues who support our political colleagues who support reproductive freedom, and that has been a really important way. It's not sustainable, though, to do it every year. Once the other Medicaid cuts hit after the midterms, that state dollar is going to become even more precious to support every single, resident who needs access to health insurance.
In New Hampshire, the numbers vary somewhat, but we've got about between 12 and 15,000 women who depend on Planned Parenthood centers for their health care, the majority of their health care. And it's creating real challenges in rural areas. I'm sure the same is true in Maine, and probably in Chicago, though not rural, but the same kinds of challenges. Can you all talk a little bit about what you're seeing with respect to general health care because of what the cutbacks that are there that are designed to address access to reproductive care, but in fact they're having much broader impact for women and families?
Thank you for the question. I'm very pleased to say that I work with 4 of the Southern Maine Planned Parenthood of Southern New England in the most southern part of our state. So I'm appreciative they're one of our sub-recipients. So it's had a broader, as I said earlier, this is not just about abortion. It's about really attacking already a fragile infrastructure. We've been flat funded for Title X for decades, and we know the increasing costs. So we've had to deal with it by not being open as many hours as we'd like to be in our more rural health centers. Rather than closing them, we've restricted hours. So but that's that's what we have to do. We don't want to not have any access.
Have your challenges been different in an urban area like Chicago?
Yes and no. I mean, we are Illinois statewide fund, so we support people up and down the state. And I think a lot of people rightfully see Illinois as the haven state that it is, but we also live in a state where only 11 out of 102 counties have an abortion provider. And that's many people who are accessing an abortion, like my colleagues have said today, that might be their only visit to a doctor, or when they're seeking support for contraceptive care, that's their only engagement with in a healthcare setting. So the more that we restrict people's ability to engage with providers, the worse health outcomes they end up having.
And to go to Senator Cantwell's point, the more it costs us.
Absolutely.
Well, thank you all so much for being here. As you know, we will continue to fight on.
Thank you very much. You have all been very patient, and we've run over time, but I just want to ask one last question, really because I want everyone to know where the anti-abortion movement is actually heading. And I'm not talking about rhetoric. I am actually talking about a very real bill that a Republican legislator has filed. It's in North Carolina. It's House Bill 1232. It would amend their state constitution to declare that a person exists from the moment of fertilization, classify abortion as first-degree murder, and this bill in its own language says, and I want to quote it, any person has the right to defend the life of another person even by the use of deadly force if necessary. I'm not sure what that means. Does the bill sponsor want women to be killed for using birth control? And that's what it sounds like to me. So Alexis and Evelyn, let me ask you directly, when a state writes personhood at fertilization into law, what does that actually mean for women's birth control, for IVF, or for treating a miscarriage or an ectopic pregnancy? Alexis or Evelyn?
Well, that's their home run, to declare someone a person from the time of fertilization. It has an impact that's devastating to all the contraceptive methods we have available. It brings into question LARCs and other things in other people's minds, even though we know none of those are an abortifacient, but yet it will chill our ability to make contraception available. Hard stop.
What terrifies me about that bill is that it is kind of the amalgamation of everything, both from personhood to the vigilante justice that we saw in SB 8 coming out of Texas, and the ability to empower anyone, anywhere, in any state to make a decision around how to, limit access, but do it by any means necessary. That is setting up a terrain of terror and fear for any woman in America. We should be terrified.
Absolutely. Thank you. Every woman and man in America should be terrified by these laws and by the intent, even from taking the Medicaid funding away, as Evelyn, as you described. Maine, who is a state that has voted to protect women's rights, it's in your constitution, is it? Or it's part of your state law? But you are seeing, because Medicaid funding's been taken away, your inability to access. So this is a very real agenda by the other side. And that is why we are here today, to outline your stories. Thank you for being here, and to let all of you know we are going to be here. We're going to share the stories. We're going to keep fighting. We're not going to ignore this. We're going to hold our heads up high, because the majority of Americans are where we are, and we're going to continue to make sure every woman in this country has the right to her own health care. So thank you all very much for being here today.